Have you ever noticed a persistent patch on your skin that just does not seem to go away or respond to typical moisturizers? Perhaps it feels a bit different to the touch, or its appearance is quite distinct from dry skin or a simple rash. Understanding what these skin changes might signify is the first step towards managing them effectively and feeling more comfortable in your own skin. When trying to identify psoriasis on various body parts, you are generally looking for thick, red patches of skin, often covered with silvery scales. These patches, known as plaques, frequently appear on the elbows, knees, scalp, and lower back, though they can develop anywhere on the body. Their distinct appearance is a key characteristic to recognize. The reason psoriasis looks this way is rooted in your immune system. It is an autoimmune condition where the immune system mistakenly signals skin cells to grow much faster than usual. Instead of taking weeks, new skin cells form in just days. Because the body cannot shed these excess cells quickly enough, they pile up on the skin's surface, creating those characteristic thick, scaly plaques and the associated redness and inflammation. To help identify psoriasis, pay close attention to your skin's texture and color. The patches are typically raised and inflamed, giving them a distinct feel when you run your hand over them. Look for clear, well-defined borders between the affected skin and the surrounding healthy skin. On the scalp, it can appear as severe dandruff with silvery scales. On nails, you might observe pitting, discoloration, or even separation from the nail bed. Also, notice if scratching or rubbing a patch tends to make new patches appear, a phenomenon known as the Koebner phenomenon. An interesting detail that can sometimes help in identification is what is called the Auspitz sign. If you gently scrape off the top layer of a psoriatic scale, tiny pinprick bleeding points may become visible underneath. This is due to the thinning of the epidermal layer over the dermal papillae. While not always present and best observed by a professional, it is a unique characteristic of psoriatic plaques. Also, remember that while plaques are most common, psoriasis can also show up as small, red, teardrop-shaped spots or even pus-filled blisters, depending on the type. Knowing these key indicators and where to look can empower you to notice potential psoriasis early. Recognizing these signs allows you to have an informed conversation with a healthcare professional, leading to a timely diagnosis and the right approach for managing your skin health. Being proactive helps you take control and find relief sooner.